I was ready for the love, I was ready for the money, ready for the blood, and ready for the ready for the winning, ready for the bell, looking for the water from a deep blue well. Found some love and I found some money, found that blood would drip from my.
It is early morning at the Kisii Eye Hospital in Western Kenya, the second clinic built by the Fiat Lux Foundation. We are here with doctors and volunteers from the foundation to meet the patients who have traveled great distances to come here and get treatment.
It started when I was young.
This is Tony, a bright young man of 17 who has gone blind from a rare eye condition.
My eyes used just to itch, then when I rub, then all of a sudden they started turning red.
Tony can easily be cured with a corneal transplant, but in this remote part of the world, access to healthcare is a luxury that few can afford. Tony's mother, Alice, is a widow who supports Tony along with his 3 siblings and 8 cousins.
I gave birth to a very normal baby boy with eyesight, but he was losing sight. So I was wondering how I was going to make it with a blind boy now.
When I read a book, it is difficult. The only thing I can see is when it is close to my face. And that has affected me much even in my studies.
Tony's blindness has forced him to drop out of school, but after this final surgery, he has big plans for his future.
When I got to the university, what I wanted to do was journalism, mass media, and communication. That's what my passion. Yeah.
We also met Baraka, a 2-year-old girl born with glaucoma who needs surgery to stop the progression of the disease and save her eyesight.
3 months after her birth, we noticed there were white, the eyes were ashy. She's very playful, cheerful, and talkative.
Hi. And then there was Catherine, an 80-year-old woman who had been blind with cataracts for 10 years. She came to one of the outreach clinics that the hospital had established in order to find patients in the nearby villages who would not otherwise be able to come in and get treatment.
She
didn't know that she could be changed. Sometimes they don't even know that that blindness can be treated. 20% of the Kenyans live in the rural areas, and that's where the needs are. So I decided that I needed to come out here to this region and then try to make a difference.
This is Dr. Daniel Kiage, a renowned ophthalmologist who gave up a thriving practice in Nairobi in order to move out to the remote regions of Kenya and build a clinic.
He had a pretty comfortable life in Nairobi, and he gave that up to go serve underserved people in rural Kenya, and I think that's really admirable.
You know, you must be nervous, that's okay, but I know what is going to take place inside there, so I am ready for it.
Is there any person that she's excited to see for the first time in 10 years?
I'm very, very happy. I'm a happy mother to see the sight of my son back.
So I think my baby will be well. I'm grateful for that. And I want her to be more educated and become even a doctor.
Yeah, my wish would be he be a doctor like Dr. Kiage. Even though his wish is to be a journalist like you guys, eh? He'll spread the message to the whole world, starting from our village. And it will reach the whole world. So people will know that if you don't have sight, it can be restored. That can be the best.
Really, it's an amazing thing that you can make such an improvement in a person's life. You can just transform a person's life with this crazy, incredible surgery that, just takes a few minutes and costs so little. And, what an impact you can have on somebody. I see it as a gift through the surgeries that I do, through the teaching that I do, through the work that our foundation does and supporting people like Dr. Kiage to, give this gift to as many people as possible. I sort of see that as one of my callings in life.